The big overarching theme with the Trump administration right now is deregulation.
By this time, in his first term, he had only signed 32 executive orders. Now he's signed 48.
Who knew that gloves was going to be a talking point about cost increases? Welcome to Healthcare Strategies. I'm Kelsey Whittle, Managing Editor and Multimedia Manager of Podcasting at Informa Tech Target. April 30th, 2025 marked the 100th day of the second Trump presidency. These first 100 days saw the new administration advance its healthcare policy in a number of ways. Here to break down the changes, we have Jacqueline Lapointe, Executive Editor of Editorial at Xtelligent, and Olivia Kaler, Senior Editor for Pharma Life Sciences at Xtelligent. Thank you both for coming onto the podcast today.
Thanks, Kelsey, for having me.
Thank you for having us.
We got a lot to unpack here today. So we're going to start out broad and then really zero in. And I'm eager to hear what you all have been seeing happening in the policy space in healthcare these last couple months, just because every change of administration is going to bring very big shifts in healthcare policy at different times. And this administration is no exception. Jacqueline, I wanted to start with you. Just talking broadly, I know you cover more kind of rev cycle management, billing, a lot of payer coverage in there as well. Can you just talk about, in those specific areas, what has been changing and any regulatory developments that you're seeing with the new administration in these first 100 days?
Thanks, Kelsey. Yeah. The big overarching theme with the Trump administration right now is deregulation. We have the Department of Government Efficiency coming in and looking at all the departments, but specifically HHS felt the brunt of that. And we'll get into that later with some of the workforce reductions. But part of that overarching idea of government efficiency is deregulation. As part of that deregulation, in January 2025, President Trump directed federal agencies, anyone who proposes or issues new regulations, to identify at least 10 prior regulations to eliminate. Again, this is a direct, we're seeing like how this is playing out, but HHS is part of that deregulation process. So while, yes, they're advancing health policy, they're also trying to pull back a lot on the health policy and make sure it's really tight, trying to get rid of anything else. Now, I think what's interesting too about the deregulation thing is that it's not necessarily pulling rules, but you can take out parts of the rules and stuff that is within these rules that kind of counts as eliminating some of the guidance, the regulation, the policy. So HHS has been on that road to deregulation. Mm-hmm. I think another part of that, which has particularly impacted healthcare, is reversing a long-standing approach for public comment on certain types of policies. So it was a little more, yes, there are some rules and regulations that require notice and comment periods, but there were a lot of them that weren't necessarily needed, but HHS still provided that comment period. They're pulling back on that. This is known as the Richardson waiver. They're saying that let's pull back on that because it is an administrative burden, specifically on the federal government. That's a policy departure that we're seeing and is going to impact health policy moving forward. Mm-hmm. That being said, yes, there's a lot of deregulation, but they have issued a lot of health policies that impact stuff like medical billing, healthcare payers. What comes to mind specifically is the Medicare Advantage rates. There's been a lot of talk about how is Medicare Advantage working? Is it saving money? Especially with the star ratings, a lot of health plans have been challenging what the government has said their star rating is. It seems that the Trump administration is really backing Medicare Advantage, though. They're bolstering the rates, which has been huge. Mm-hmm. Same with hospital outpatient, the Medicare outpatient prospective payment system. They bolstered the rates as well for the next fiscal year. However, we are still seeing continued Medicare cuts to the physician fee schedule. That is very controversial, but that is something that's been in play for a couple of years now. It's not new to the Trump administration. So that's kind of where the landscape is for those major health policies that come out every single year. I did want to note, though, that the administration's also targeting healthcare fraud, waste, and abuse. I think a lot of that is going to be pushed to the Medicaid program. There is a huge push to reduce spending, federal spending. Healthcare obviously makes up a ton of that. We're talking like $4 trillion in spending on healthcare. Right. It's a little bit difficult, though, because the Trump administration has really said that they're not going to cut benefits like Medicare, Social Security. So where we are likely to see more cuts is Medicaid. And I think you've seen the Trump administration already start to try to tighten that program up to see if they can improve efficiency and reduce spending. I'm specifically talking about the 2025 Marketplace Integrity and Affordable Care Act proposed rule. Again, this is a proposed rule, hasn't been finalized yet, but they're really trying to ensure those who are eligible for Medicaid are getting it. So What they're doing is strengthening income verification processes, modifying eligibility redetermination procedures, just making sure they're reducing improper enrollments, and that will also improve the risk pool, according to the Trump administration. So we're going to see a lot, I think, more changes with Medicaid, and that's been what's bubbling up now. Another aspect with the government efficiency is workforce reductions. We're seeing them across federal departments, but HHS specifically, they've announced that they want to cut 20,000 employees. So going from 82,000 to 62,000, we've already seen a ton of this happening. And I think specifically, it's been a little concerning with the FDA. The FDA, they promised to reduce the workforce by 3,500 people. I think Olivia has a little more to say about that and how that's going to impact life sciences and pharmaceuticals.
Yeah, absolutely. So we're talking with those numbers, right? The 20,000, whether they're forced out, fired, forced to resign, whatever have you. That's 20% of staff at FDA.
Wow.
That's a lot.
Yeah, that's significant.
And so I can just think off the top of my head, there's several experienced leaders in these centers within the FDA. For example, Dr. Peter Marks, he's the director of, was the director of Center for Biologics Evaluation and Research. And he resigned after being asked to quit or be fired. Basically, he was the director, the number one guy when it comes to overseeing vaccines, cell and gene therapies, and regulation among those. So just right off the bat, we're going to be seeing impacts down the line to vaccine approvals and cell and gene therapies approvals as well, and regulation, not just approval. And also Dr. Peter Stein, he was the director of the Office of New Drugs. So again, Office of New Drugs, we're talking about approvals here.
Right.
He left after he rejected a different reassignment. They gave him a different reassignment and he chose to leave. And he led the drug review modernization process. So like making sure the review process is up to date and modernized. That's important. So Jackie, as you were talking about waste and abuse and fraud, I'm not sure what the point of getting rid of him was here, because he is in charge of reviewing and making sure that we are up to date and we have efficiencies within our approval system and review system. And then we have Dr. Ross Segan. He was the director of the Office of Product Evaluation and Quality. I think his position was eliminated through reduction in force. So his job was cut within those 10,000 staff cuts. And those are just a few that I can name off the top of my head. And these, although we're not going to see the impact right away, we are going to see fewer routine inspections, and that may delay identification, say, of contaminated drugs, food, devices, cosmetics, things that the FDA reviews. And it's going to affect foreign inspections, right? So when we get our imported goods, especially when we think of high risk categories like active pharmaceutical ingredients, often called API, we need regulation to make sure that those products coming in is safe.
Mm-hmm.
And so with all of these factors, we're going to have longer approval times, longer timelines to get drugs to market in the hands of patients who need them. And especially with the cell and gene therapies, these are some drugs that are very expensive and they're hard to get already. And we're looking at throwing wrenches in the approval process. So that seems counteractive to me.
Right.
And that being said, this is just trending. So I don't know if it could speed up later on. But so in 2024, the FDA approved 50 novel drugs, meaning these are new drugs to market. By this time last year, 15 novel drugs had been approved. So far this year, only 7. So we're about half already.
Like half, yeah.
So we're about halfway already from last year. So if we're looking at delayed timelines, I'm not sure if we're going to be picking up the pace for the rest of 2025. But that's my prediction on that.
Yeah, I just want to jump into, because I think it's interesting. We talk a lot about like the fraud, waste, and abuse. That's definitely a major target. We've seen the new CMS administrator, Dr. Oz. That's really his focus when he was confirmed. He mentioned that it's definitely a balance. We're trying to find how efficient can we be with a leaner workforce and reducing so much federal spending on healthcare. But I think it is important to note as well, with the administrative stuff now, this conversation we're focusing on, how health policy and regulation impacts the operation of the healthcare system. There's obviously going to be a lot of clinical aspects that are going to be affected, but for this conversation, I think it's important to note too that administrative waste in the U.S. healthcare system is immense.
Right.
There's a highly cited health affairs study that says administrative waste in the U.S. healthcare system costs between $285 billion to $570 billion annually, and that accounts for between 7.5% and 50% of all national healthcare spending. So there is room for improvement here.
For sure.
And I think that's where we're seeing the health policy and regulation starting to focus on. I think we got to find the balance.
Right.
So we're seeing the Trump administration work through a lot of that. For example, yes, we're cutting a lot of the HHS workforce. They've already had to bring some people back on because we're finding that some of these cuts aren't necessarily working, or the priorities that we need to focus on for public health, public safety, they actually need more resources there. So I think that's something we'll see in the next 100 days as well, is that balancing of how efficient can we be considering all the leaner processes in place.
And Jackie, I kind of want to jump on that as well, because you're talking about cutting fraud and waste, and then Trump making certain cuts and having to bring these people back. I think that there's also, those people were only brought back because they realized the immediate impact. Some of these you're not going to see immediate impact. For example, for the drug approvals, they're probably just going to say, okay, we have less people to review.
Right.
Fewer reviewers, fewer inspectors for our safety evaluations. Let's just move forward. Let's do more accelerated approval pathways. Can you guys see where there's problems there?
Yeah.
Like, maybe we shouldn't put every single drug in an accelerated approval pathway, because there's reasons why not every drug is put in accelerated approval pathways. So you're gonna end up seeing, maybe if drugs do get approved very quickly through this approval pathway, they're not going through the rigorous scientific public health testing and verification before it gets put out with that stamp of approval. For example, if for our audiences, we all know that the COVID vaccine, that went through the accelerated approval process, but that was only because it was a high need vaccine for the global population. So you shouldn't be doing that with an everyday drug, right?
Yeah, I think that this really highlights the tension between the reality of our system has been struggling with, as Jacqueline was bringing up, overspending and wasteful spending in a lot of areas for literally decades. And there's been a lot of efforts to try and cut down on that. And the question is always, what is the right way to cut back on these? We all recognize there's an issue here. And the question is, what is the right way to deal with it? And this administration is definitely taking I think it's not overstating it to say, a pretty extreme approach,
They're laser focused on improving efficiency here, yeah.
right, with a method that is fairly extreme. And I think we are seeing that in the sense that having to bring people back in speaks to the fact that too many people have been cut out. And I think that's a fair point to bring up, Olivia, about if we see that there's certain things where we're going to see the immediate impact. There's certain things that we might not see until later down the road. And that's really what I'm interested in hearing from you all, is like, I think you both have these spheres in the pharma space and in the payer/rev cycle space, where we will see a little bit of both. We'll see some of these decisions have immediate impacts on some of these decisions. We won't see the impact until potentially a couple years down the line. So I'm curious, as we're looking at this situation, some of this was expected, that the Trump administration was going to take this kind of approach. It's not completely out of the blue. The Trump platform has largely been about deregulation, and especially potentially in the healthcare space. So this isn't coming out of nowhere. I am curious to hear from you all if there's been any shifts that we're seeing between the first and second term here and the way that he's taking this approach. We did not see, to my knowledge, these massive cuts in his first presidency, at least at this level. So I think we're already seeing there's some differences in the second presidency versus the first. And then there's some things that are consistent. Like I said, there's a reason why there was this expectation going in that there's going to be a level of deregulation happening. I think in my conversations, a lot of that was around AI. We actually were expecting there to be a lot of lack of regulation. There already isn't a lot of regulation, but there was going to be a de-emphasis on regulating AI in healthcare and broadly speaking. Curious, Olivia, if you could kick us off here, what you are seeing that is unexpected, what you're seeing that is expected based on his first term and now his second term of presidency.
Sure. I guess I just want to start out with the tariffs. I am terrified, as one would say. Right?
Mm,
No, I spoke to two experts about this disruption that these tariffs are going to bring to the drug supply chain and the med tech sector. And I'm just going to wipe the China tariff off the table right now because I'm not
okay.
even going to play with that number. I'm just
Okay.
going to deal with that 10% baseline tariff
Mhm.
that is definitely going to affect pharma. That's going to be applied to like I said before, the active pharmaceutical ingredients, the other components of drugs for compounding, for packaging, manufacturing equipment. Most of that stuff is bought overseas and then brought here. For example, 53% of the API used in medications consumed in the US is produced domestically. So we're looking about half and half here closely. So just the APIs, the active ingredients that we're looking at 50% we come from across seas. And that's just one component. Like I said, we're talking about the manufacturing equipment. You're talking about the compounding, the filtration systems, your filling systems, your sterility systems. There's a lot that goes into it, and a lot of that does come from overseas. So you're thinking 10% base tariff, tack on at least 10% on that, and then you have to think like down the line, right? If you're adding all this money on components, equipment, where does that lead us, right? Or does it mean like we have higher cost drugs? Our drugs are already pretty expensive, so I'm not sure if we can afford that. So we're looking at, I think it was a Peterson Institute study that said it predicted a 5 to 9% increase in name brand price drugs within the next 2 years. And that's just with, let's be real, drug prices are not going down usually unless we have legislative action.
Right.
And I think that this is going to be a huge change because he's also talking now about tariffing things that were historically duty free,
Mhm.
Mhm.
like finished pharmaceutical drugs. Those originally were duty free, those have been protected under the World Trade Organization for decades. So now we're talking about maybe tariffing generics. The generic market already works on very slim margins because it's very different from name brands. They don't have that patent exclusivity anymore. And these are also like generics. Think of just a vaccine, like the flu vaccine or something like that. That's a very small profit margin. And if you are then tariffing everything to make it, they're not going to make the product anymore because they can't make the product and make a profit. They will ultimately be losing money in the end. And that's going to hit our supply chains and obviously impact market access for our patients. So I think the tariffs on he has announced that it's a plan, but again, all of these have just been plans because most of these changes have been done with executive orders, which we'll talk about the impact of those down the line.
Right. Yeah.
But so I think that's probably the biggest impact that we're going to see because that's going to hit med tech, drugs, all aspects of healthcare, in my opinion.
Yeah, and I think too, healthcare providers themselves are a little nervous about what the tariffs can mean for their supply chains. Drug spending's already been significantly higher, especially post-COVID, which is impacting especially hospital bottom lines. We're still seeing higher than expected expenses compared to, stuff like volumes, which are still stabilizing after significant disruptions from 2020. So hospitals are still trying to figure that out as well. And I think this is giving everyone a little bit of worry to see how it's going to truly impact the prices of things like medical devices, key supplies like gloves, syringes, that sort of stuff. That
Yeah, I did
Mhm.
actually speak to an expert, had good insight that said that any company who is looking into different types of pricing or different if they're looking into change the way that they source or that they should constantly be checking with the harmonized tariff schedule.
Mm.
That harmonized tariff schedule is like basically what the US uses to outline the tariff rates and statistical classifications for all imported goods into the country. And I think that with all these changes, you'll be seeing some companies try to diversify their supply chain. And in doing so, you may be importing from a different source. The tariffs may be, maybe working in, maybe going from China to Taiwan or something like that. And you're going to have to keep up to date with Trump's tariff announcements and what's being listed on the harmonized tariff schedule. Because what's being said may not actually you may not actually be into effect. So make sure you're looking at the harmonized tariff schedule.
That's some really good advice. And I think that is something that we can touch on later too, of the key being everybody really needs to be paying attention very closely to the difference between what is being said and what is being enacted into law. We'll get into that in a minute, but I think those are really good points. And I'm glad, Jacqueline, you brought in the point about I think a lot of attention is focused for good reason on the impact on drug costs because that is an area that we as a healthcare industry have been really focusing in on for a while because it has had such an impact on patients being able to get treatment and cover their treatment. And for a good reason, that's been a big talking point for literally years. But this is going to go even down to gloves. Like, what is the cost of gloves going to be? And as you can imagine, hospitals use a lot of gloves. I don't know the exact number, but I don't need to know that they use a lot of gloves if they're doing it right. This is going to have some far reaching impacts on even areas that we, I think, have not seen be a talking point. Who knew that gloves was going to be a talking point about cost increases? Yeah, those tariffs, definitely what I'm hearing here is the main shift is the tariffs because that was a fairly unprecedented move, just generally speaking, not even just for the healthcare industry, and that it's going to impact the healthcare industry in ways that are probably unprecedented.
And I think, too, just to bring it back to how the Trump administration compares now versus the first term, I think it all wraps in with this idea of a broader health policy landscape. But I think it's interesting that on the campaign trail, President Trump really wasn't as focused on healthcare as he was the first time around. And specifically, I'm saying the repeal and replace the Affordable Care Act. So I think that's like a major shift that we're seeing is that there was less of a focus on the campaign trail. Now it was still a major focus, but I say there was just less emphasis on it. And there was less of that fight against the Affordable Care Act. However, I think we're still seeing a lot of the repeal stuff coming down the line, just not necessarily the replacement aspect of it. And again, that goes back to the Trump administration is trying to identify policy and regulation to increase efficiency and decrease spending. And a lot of that is going to be with repealing Affordable Care Act provisions. I'm specifically thinking now that Congress is back in session, they're really considering cutting federal matching funds for low income Americans who gain coverage through Medicaid expansion. The government provides an increased rate for those individuals to incentivize expanding Medicaid eligibility and coverage. That's a major focus. They're saying, hey, let's roll that back, and that's how we're going to reduce spending. Now, that was a big part of the Affordable Care Act. Medicaid expansion was one of those major changes that impacted the country and impacted coverage for Americans. We're also seeing policymakers and lawmakers are cutting navigator services for the Affordable Care Act marketplaces. So we're seeing a lot of that. That's where kind of like the repeal aspect is coming. And I think it's going to be difficult to do the replacement stuff when we're talking about deregulation and all that. Healthcare stakeholders aren't necessarily going to be able to engage as much in the conversation about what gets repealed and what gets replaced. And I think that could open up to some of these policies and regulations that come out to a little more litigation. Those comment periods kind of help to provide a little more information on how policy will impact providers, payers, pharmaceutical companies, life sciences companies, any kind of stakeholder within the healthcare system, and even with beyond it since it was a public comment period. So we might see a little more of that as the second term of the Trump administration continues, the litigation aspect. I will say, though, it's interesting that we talk about how things have changed. And yes, President Trump has always been for repeal and replace the Affordable Care Act, but the administration actually did defend certain provisions of the Affordable Care Act. There's a Supreme Court case that just came through about preventive services, whether those should continue to be at no cost sharing. Specifically, the case had to do with who's recommending what services are subject to that no cost sharing. We're talking things about like HIV prevention drugs, depression screenings. So the Trump administration did choose to continue to defend that with the Supreme Court case. The case has been ongoing, so this is not new to the Trump administration, but they did choose to defend that. And it seems like the Supreme Court is going to uphold it. We're still not sure yet because they just heard the arguments, but that's a little bit of a twist in how things have changed over the course of time.
Yeah, I'm really glad you brought that in because that was definitely a kind of main sort of call of the first term of this administration, of like a big part of their platform around repeal and replace the Affordable Care Act, repeal and replace ACA. And it's interesting that, as you mentioned, like that sentiment hasn't necessarily gone away, but maybe what I'm hearing is like a different approach of maybe more surgically removing certain parts or stunting certain parts while keeping other pieces going, at least temporarily. I'm curious if that will continue for the next 4 years or if that's just a kind of first 100 days we're not seeing any movement yet, but we'll see. Who knows? So interesting kind of change maybe in strategy, although I think the overarching sentiment has been expressed as like still there. But yeah, thank you for bringing that in. I know, Jacqueline, you touched on this a little bit in your first answer. I wanted to dive a little bit more into healthcare stakeholder engagement because as all of these changes are coming out, the normal routine is when you go through creating a new regulation in healthcare, which is not necessarily what's happening here, but the kind of normal routine is that the public gets the chance to respond, healthcare experts get the chance to weigh in through a public comment process. That is a big part of how our listeners might be thinking about responding to these changes, these shifts. So I would love to hear what is changing. Is there anything changing in the ways that healthcare stakeholders get involved in this conversation about policy right now?
I think the other thing with stakeholder engagement is that, specifically from the healthcare provider side, there's a lot of concerns about the loss of Medicaid coverage. Um, that means more people are not covered. I think there might be gaps in coverage. They might not necessarily switch to employer sponsored health insurance or some of these marketplace plans as quickly, especially with the loss of something like the marketplace navigators, where there's not a lot of resources to help people bridge that gap in coverage. For providers, that's quite concerning. That's increased uncompensated care costs. They're already operating on thin margins in general. The engagement in that aspect is that they're saying, hey, maybe we pump the brakes on this. We're seeing a lot of sentiment around that, particularly from medical associations as well as patient advocacy organizations. They're quite concerned and they're quite vocal about how they feel about coverage losses specifically. Not only is it bad for the bottom line, which again is something I focus on a lot more just because of my beat, but also this is a public health issue. Loss of coverage means delayed medical services and lost access to care. Major issue there. But stakeholders have been very vocal, I think, from local, state to national, saying this is what we like, this is what we don't like. Time to get lobbying to Congress and see what we can influence there.
Yeah, good to hear that the healthcare providers have continued to be vocal about the things that they think should be prioritized. We are a democracy. That is absolutely what should be happening. That's what we want to see. We've talked a bit about, I want to go back for just a second here. We've talked a bit about the things that were different between the terms, tariffs being the main thing. I want to go back for a second because I realized we didn't really dive in too much on what's been the same, other than maybe sort of the ACA sentiments. But Jacqueline, is there anything in particular that you've noticed that hasn't changed between the first and second terms in terms of healthcare policy, approach to healthcare? What are you seeing on that front?
Yes, I think something that's been very consistent is healthcare price transparency. That is something that President Trump started in the first term, requiring hospitals and health plans to reveal their pricing, including negotiated charges, making that available to the public, and then providing consumer friendly versions of that. He has doubled down in the second term, saying we need to enforce this a lot more because compliance has historically been very low for various reasons. I think there's a lot going on here in terms of it is a major data project to bring all your charges in, make it in a presentable format, comply with all the technical aspects of it. I'll just leave it at compliance has been particularly low among hospitals, a little better among health plans. But Trump has signed an executive order saying it's time to really enforce this. Hospitals particularly face civil monetary penalties if they are not complying with the requirements. But again, this is an executive order, so we're waiting to see how this plays out. But it's definitely he's been very consistent with saying this is a major area in healthcare that we need to focus on. Biden continued with some of it. He provided some changes during his administration that Trump has now reversed just because he wants more dollar and cents pricing versus some of the more technical ways of displaying pricing information. That was the changes under the Biden administration. But yeah, he's very consistent about saying this is where we need to focus. Consumers need transparent healthcare pricing to shop around for care and make care more affordable.
Yeah, and I think that's been something that it has been like the whole push for better efficiency and less waste. I think that price transparency is definitely something that over the last several years has been a call amongst the entire industry of we need better. Of course, people have different opinions about how to do that well. But I think that is something that we're seeing a lot of pressure on. And so it'll be interesting to see how he tackles that issue going forward.
Mhm.
You mentioned
I think too, just to mention Kelsey,
oh, yeah, go ahead.
and say how to do it well and how to do it because
At all.
it's just yes, exactly. Like I said, this is done through executive order, and I think one of the reasons why Trump has doubled down on the price transparency stuff is because enforcement has also been notoriously low. Because the executive order directs CMS to enforce this. We haven't seen too many penalties come up.
Mm.
There's been some discrepancies with the hospitals that are called out for not having this pricing information. So I think that's where things are going with health policy and regulation as well.
Yeah, yeah, more enforcement, more, like you said, doubling down. Yeah, and as you mentioned, this is coming down through executive order. Executive order has been the way that a lot of healthcare policy language from the administration is being handed down right now. Can y'all share a little bit about what that means for the healthcare industry? Not everything that we've discussed today has been exacted through executive order, but a lot of it has. So, can you break down for us what exactly does that mean? Like, how tangible, how weighty are these things on a legal standpoint? Recognizing, of course, y'all are not legal experts. You can plead the fifth if you want to, but I'm just curious how this is being digested by the industry, how much of this is being taken in as law versus suggestion right now. Olivia, did you want to tackle this one?
Yeah, I'll go ahead and take it over. Also, too, just to go back to what's the difference between his first and second term. By this time, his first term, he had only signed 32 executive orders. Now he's signed 48 after his first 100 days. So we're looking at an increase of 16. So he's definitely heavy handed on the executive orders. But as you said, I am not a legal expert, I am a scientist. But I can tell you, because I looked up the definition, so I can tell you, according to the internet, what an executive order means. And that's really just a directive by the president of the United States that manages the operations of the federal government. These executive orders are binding instructions for federal agencies, but they don't override current law.
Okay.
So, for example, if any of these executive orders overrides a current law or would hamstring a certain law that's in place, then that's where you're going to go to courts and you're going to have that legal battle and figure out what needs to be changed, what needs to be done. Is it totally
Right.
squashed, whatever.
Yeah.
And so that's why the executive orders are, yes, they're faster, but they are also more vulnerable to being overturned in court, especially if they have a problem with them. Or they could be very easily reversed by future administrations since they are not legislative law.
Yeah, I think too is a lot of the executive order directs a agency like HHS to do something, and as we know in healthcare, things take a long time to do. It might direct them to create policy around something like price transparency. It might take a little bit. I think a good example is with the enforcement of the hospital price transparency requirements is that CMS has been directed to enforce it, but we haven't seen as much enforcement considering data on compliance rates showing that the compliance is very low. We've only seen, I don't even think 24 warnings that are public warnings about hospitals that are not complying with the rules. So I think it's a little bit complicated with the executive order versus something like actual health policy and regulation. There's a gap there.
Makes sense. Thanks for breaking that down because that is like a very important part of all of this is understanding how much weight it pulls in the legal sphere and what to expect on that front. I think I saw that there's at least 100 lawsuits right now on the table over different actions by the administration in the last 100 days, not necessarily specific to healthcare, but just in general.
And Kelsey, I also like to point out too, now that you're talking about it, the recent announcement with like synthetic dyes, there's no law banning any synthetic dyes. Just to be clear, it's an executive order asking, it was a news release really, just asking companies to comply with phasing out certain synthetic dyes. So like
Mhm.
even FDA news releases coming out that has no legal weight to it. So I think that it'll be interesting to see, do these companies and stakeholders do what this administration wants through these executive orders, or do they just do what they were going to do anyway because it's not law?
To view these executive orders too, they definitely should inform strategy for healthcare stakeholders. This is clearly where the administration wants to take things. We're going to see a lot more things down the line. So maybe it's time to start putting these on our radar and crafting strategy around. What if we do get a regulation around the synthetic dyes? That's going to impact stakeholders. They should probably have a plan in place for something like that. So yeah, definitely something to inform strategy at this point.
If anything, the way that I've learned about it through my reporting is they're almost like warning letters. Like these executive orders are just like, look, this is how we want to run things. We're just going to let you know how we want to do it. Doesn't mean it's law.
This is a precursor.
Yep. To what to expect. Yep.
Good points. Good points. It's going to probably test the nimbleness of our healthcare organizations a bit to see as things evolve. I think what we're seeing is there are changes on the horizon one way or another. We're not sure yet where it'll all land, but it's good to keep updated. And so we're glad that you guys could come on to the show today to do just that and keep us all posted. So we might have you back on in the next 100 days. See where we're at then. Who knows?
We shall see.
Yeah, we shall see. Thank you both for coming on to the podcast today.
Thanks.
Thank you, Kelsey.
Listeners, thank you so much for tuning in to Healthcare Strategies. To learn more about these topics, go to techtarget.com/healthcarepayers and techtarget.com/pharmalifesciences to read Jacqueline and Olivia's work and get new Healthcare Strategies episodes as they air by subscribing to the podcast on Spotify, Apple, and other major podcasting platforms. And if you like what you heard, leave us a rating and review to help others find the show. See you next time. Music by Kyle Murphy and production by me, Kelsey Waddell.
This is an Informa Tech Target production.